October is Breast Cancer Awareness Month, with more than 360,000 Americans expected to be diagnosed with breast cancer this year. Of course, it's an important topic to talk about, especially when it comes to how people can reduce the risk of breast cancer. And here to talk about that very topic is Dr. Nancy Taft. She's Chief of Breast Surgery at Denver Health. Of course, thank you so much for taking the time. I'm sure it's a busy time of month for you. Thank you for taking the time to be here with us. So the first thing we want to talk about is who is the most at risk of being diagnosed with breast cancer, and what should they be doing if they fall into that category?
Well, first of all, Erica, thanks for having me today. Risk is mainly, the group is women, people who are born biologically women. And if you think about it, it's actually pretty common. 1 in 8 women are forecasted to get breast cancer in their lifetime. And I think most of us know someone who has breast cancer. Men get breast cancer too, although it's less common. So I really wanted to mention that, especially during this month. About 1 in 830 men will get breast cancer. And if you get breast cancer, the main thing is at that point in time is that your radiologist will call you with your diagnosis, and that you get immediately to a treatment team and get the process started.
All right, I'm going to go a little bit out of order here because I do want to touch on this. I think it's so important. When you are diagnosed early on, I'm assuming your chances of survival, your chances of being healthy after the fact are greater. Can you talk about that early diagnosis and why that's so important? Early detection.
Early detection, yeah, it definitely uncomplicates the situation quite a bit. And a lot of times, I'm a surgeon from a surgical perspective. A lot of times it means less surgery. Sometimes people, if it's really early, can omit radiation. Maybe they do or don't need chemotherapy. So it really has a big effect on the amount of treatment, the time of treatment, and the long-term side effects of the treatment.
And because you do have that expertise when it comes to breast surgery, can you talk to us about when someone might be recommended for surgery, and if they are recommended for surgery, what they can expect there?
So most of the time, as soon as someone gets a cancer diagnosis, we're very empathetic on our end of it, that we know that sitting at home with that and not knowing what's going on is pretty stressful. So we've made a commitment to get people in 48 hours or so. And then usually I'm the first person to see them, but we talk about their diagnosis, and we come up with a comprehensive treatment plan. And a lot of it is just getting to know people and know what's important to them. Sometimes more surgery isn't always best, so we help them decipher through that.
So obviously an important conversation to have with your physician, your doctor. Let's talk about breast care centers. From what we hear, they're evolving and they're continuing to evolve. Can you tell us what patients can expect?
So, and I think you hit on the word center. Yeah. So, I mean, I've been in places where years ago that they would go get a mammogram in a facility in a strip mall. Yeah. And I think in a center, what you're looking at is not only diagnosing people, but you're also looking at treating them. Yeah. For instance, at Denver Health, if you get treated, your treatment team is in the same building right down the hallway from your diagnosis team. And I think that really keeping everything under the same roof, and there's better communication, and I think it better helps with the treatment flow. All
right, and just really quickly before we go, can you tell us about the shirt that you're wearing?
Yes, I've got this great T-shirt that I'm proudly wearing, and we're going to, at Denver Health, we're very involved in the Susan G. Komen Walk. I don't know if people have ever gone to a walk, but they're really a lot of fun. Yeah. It really celebrates the survivors and people who've lost their lives with breast cancer, so it really brings people together.
It is beautiful to see that Sea of Pink. We, of course, are sponsors, and we will be out there on Saturday as well. We have more information posted at KDVR.com.